So we decided to do a video about cupping because we've been getting a lot of questions about that, and we wanted to really just kind of answer some questions based on performance. I know there's some kind of Chinese thing going on with cupping, and I don't really want to speak on that because that's just not my expertise. So I kind of wanted to give you my opinions on what cupping is and related to performance and what you're seeing Michael Phelps have those marks you see on him at the Olympics. So first things first, cupping is a functional modality, meaning it's working the soft tissue. And so I kind of brought some props here to show you. This is a cup. This is one of the things one of our massage therapists, Daniel, does cupping. And so what it'll do is it'll go over the skin, and either you'll have a candle or you have something to create pressure on that skin. So when we create that pressure, it sucks up the skin, and the practitioner doing it can move it around. It lifts the skin, increases circulation, breaks up some scar tissue. So kind of another prop that I brought is this Velcro. So you can imagine that, somebody that's got some adhesions in their shoulders, a lot of the swimmers on the US team right now in the Olympics are using cupping more for performance, not for an injury. They don't necessarily have an injury. They're just trying to increase blood flow and increase, the range of motion. And so the way they're increasing the range of motion is, imagine these guys are elite athletes, and they're putting their bodies through hell every day. So they're overusing those tissues. So a lot of times there's layers and layers of muscle tissue. And what happens is they kind of get stuck together, kind of like Velcro. You see how that kind of is pulling apart? Well, these muscle layers get bogged down. And so now they're all stuck together. And you can see how if that's in your shoulders, if you're a swimmer, how that's limiting your range of motion. So what the cup does is it comes on the skin, and we lift the skin, and then when we're moving that cup over that now muscle tissue that's adheres together, we're freeing that up, and we're allowing that to slide over one another. So the reason why you see bruising, not necessarily, this bruising doesn't really hurt. That's why people say, man, that looks horrible. I mean, I had it done to me, and I went home, and my son saw it, and he goes, Dad, that's a bad massage. And it wasn't that it was a bad massage. I didn't even feel the bruises on there, but I felt like I had increased range of motion. So again, that cup goes on there, we lift the skin, and the bruising that you're seeing is there's blood, there's capillaries, there's different kinds of vessels in here that a lot of times when you're breaking that up and tearing down that scar tissue a little bit, or even just lifting the skin tissue and separating those layers, you'll get capillaries that rupture in there. And then that is just what you're seeing when you see that bruise that is on Michael Phelps's shoulders and all that kind of stuff. So that's basically how they're using it for performance. But remember, it's a modality. We have a lot of soft tissue modalities. We have ART, we have Graston, we have all these different modalities. And remember, that's dealing with muscle tissue. There's always, to any injury component, there's a structural and functional component. Structure is bone, function is muscle. So you as an athlete, or even as the normal person hacking away at their computer, you have to find the right modality that works for you. So this is just one of those modalities that we wanted to explain because we're getting a lot of questions on. So I hope this helps. Please share these and tell people about them. If the way you share them tells us that we're going to do more of these videos. So the more likes we get, the more shares we get, the more we can do this for you. So we appreciate you, and thank you, and hope it answers a lot of your questions.